there, Lions of Liberty fans. I'm here with you today for a special bonus segment where I'm going to speak with one of our sponsors from Health Excellence Plus. A lot of you guys have had a lot of questions about this program, so I wanted to bring on my man, the co-founder of the Health Excellence Plus program, Jeff Cantor. Jeff, are you ready to roar?
I am totally ready to roar, Mark, and on behalf of all of us free market consumers in the medical world.
All right, Jeff. Well, you and I have spoken quite a bit, and I know that you are very passionate, not just about your political beliefs, but about this program, the Health Excellence Plus program. We've been working with you guys for a couple of years. It's changed a little bit along the way as you've learned about about your consumer base and dealt with federal regulations and all that fun stuff. But why don't you tell us right now, for people that are new to this, for people that have heard the ad but don't exactly understand what this program is, what exactly is Health Excellence Plus?
Well, just to give it a real basic feel, Mark, it's really starting from the bottom up for a change. It used to be that way when years ago the doctor would come to your house and you'd just pay that person, and then you also had hospitalization in case something bad happened. And the next thing we know, we're driving to the doctor's office and we're having a small copay. So that just got so many layers between you and your doctor that whole doctor-patient relationship's been destroyed. So the essence of what we're doing is getting back to that basics where it's you and then your health and your health issues if you have any, and then that person that's helping you, which is usually a doctor, is your starting point, and everything else is to support you and your doctor, and that's exactly what we're doing. But on top of that, we are really incorporating in a big way the idea of avoiding. So most people don't want to have the heart attack. They want to know that if they have one, they're not going to have to worry about the bill, but they'd rather not have the heart attack. So we focused a lot more on that for sure than what we were doing in the past. And we also now are incorporating a health savings account, because a lot of stuff that has nothing to do with your health insurance or even that stuff that we're doing for you is the stuff you're going to spend money on. Buying a prescription, getting my teeth cleaned, buying some glasses or something. None of that can be traded as a claim, but here you'll be able to use your HSA to pay for all those things and write them off on your taxes. So we've incorporated a lot more features. And then again, remember, we still have that concierge aspect, so that this way, if I know, oh boy, I could get an MRI, but the doctor's suggesting I use the hospital that they work at, and it's $3,000 over there, and actually closer to my home, I can get the exact same one for $300. Well, that makes a lot more sense for everybody involved, including the person who's making the decision to go, because they're going to save money for themselves as well as for everything else that's going on, help keep costs down in the medical world, because they did a simple thing. They just shopped around. But the reality is no one knows how to do it. So we make it so you just call a number, someone does it for you, and you can take advantage of it or not. It's kind of up to you, obviously, because it's your decisions. But the nice thing is you've got the capabilities to really function in a free market way without having to become an armchair expert to do it.
So basically, this is bringing a lot of consumers back to actually making their own decisions about where they go for healthcare and that sort of thing, but without having to pick up the phone book and thumb through it and actually start calling places and comparing prices. That's something that you guys will all take care of.
Yeah, exactly. I mean, the truth of it is, if you go to Google anything nowadays, you get like 2.5 million responses. So how are you going to sift through all of that? And you don't even know what you're looking at anyway. But you do know what you need. I need to get a better doctor. I got a crazy price on this medication. How do I get a cheaper price for that? I need to, find a better price for an MRI or a different kind of a lab or whatever it may be. You're going to need someone to help you do all that, and this way it's all built in automatically. And then on top of that, you have a 24-hour day doctor access. So if you get sick in the middle of a Saturday night, instead of rushing to the emergency room and clogging up that place, one, it's going to cost you money, and two, somebody that really needs help is going to show up and you're filling up that slot with your sore throat. You call a doctor 24 hours a day. They can prescribe a medication if need be, or tell you, you know what, you better rush to the emergency room or it can wait till Monday when your doctor's in, type thing. And so this way it's very convenient for you as a consumer, but really importantly, the price stays low. And that's the big problem we're all encountering, is that the fact that in the health insurance world, those prices go up and up and up and up continually without ever seeming it to be a break in sight. And yet the way we've been doing it, and as you commented, we've been doing this for years, we haven't changed our prices in all these years we've been working together. So it's a much more stable way to do it when you put the consumer in control for a change. But when you're in a world where they don't know what anything costs and they're being led around like little lemmings, it's easy to take advantage of everybody.
A lot of people out there listening right now are just used to having your kind of standard insurance that's either purchased through a company or that they purchase on their own, and they're used to your copays, your deductibles, and being told you're in this network and that network. What are the biggest differences that the Health Excellence Plus program offers compared to that standardized insurance that we're all used to?
Well, that's a perfect example to describe the problem we're in the middle of, because they're controlling who are your choices. We were just on some media events recently, and the conversation was about Aetna trying to buy CVS. Well, what could be more of a sweetheart arrangement than the insurance company owning the sole drugstore you're allowed to go to for all intents and purposes? That's going to be fantastic for them to make money on both sides. But you as a consumer, now what are your choices? There goes Walgreens, Walmart, Costco. All the rest go out the window because they've locked you into a very specific vertical model, and they're going to be able to control or manipulate or at least overcharge in certain respects to what they're doing than if they had to sit on a corner with 3 other gas stations and compete on pennies to get you to come into their gas station. And so it's not really good what's happening.
Now, who exactly is Health Excellence Plus for? Because this really is situational, and I think even you will say that this is not for every single person out there. A lot of people might have insurance that's heavily subsidized by their company and is really pays a high percentage and has a low deductible. Might not be right for them. There's some other people that might have very low incomes and might have a highly subsidized plan from the government, so it might make more sense for them to stay on that. So who exactly should be looking at a program like Health Excellence Plus?
Well, that's an excellent question, and it is situational. And this may not be for everybody on a couple fronts, because there might be some health reasons why maybe you want to stick with what you've got, or by the same token, what you were talking about, where their financial situation is a little different. Now, basically, we're set up to talk to individuals, meaning singles, couples, or families just buying insurance or something for their health on their own. And then for businesses, we're working with companies that only go up to a maximum of 49 employees. So we're in that small business market. But other than that, if they're working, somewhere, then you've got a very good subsidized program. But let's say you're married with kids, and if you want to add your wife and kids to your plan, it's going to cost a lot of money, then we can just take care of that spouse and the kids and treat it as a single parent arrangement and allow that family collectively to do a lot better financially. But if they're subsidized, like you said, by the government, or they're somewhere where they're largely paid for by their employer, they may find what we're doing appealing. But I always tell everybody, you really have to look at your wallet, because that's really very important. I mean, your health is paramount, of course, and the next thing you need to worry about is your money. I mean, that's the whole purpose of insurance, ideally, is to protect your wallet. It's not about protecting your health. It's protecting you from financial ruin. So it is about money in the end. I was just saying, we're lucky that we're priced like we are, because for the bulk of the market that's in that middle zone I was just describing, we're far less money than any of their other alternative options.
Gotcha. Now, one more thing that I wanted to ask you about, you mentioned in the beginning there that one aspect of this is that you are actually looking at before people get sick. We always think about how are we going to pay for this heart attack, but really what we should be focusing on first before we get to that is how do we not have the heart attack? How do we, how does our health improve so we aren't even getting to the point where we have all these problems? I mean, paying for it is one end of it, but I think ideally, like you said, most of us would rather just not have the illnesses. Now, obviously, there's a lot of things that we cannot prevent, accidents, genetic diseases, things like that are just going to occur no matter what we do. But what does Health Excellence Plus actually do to help people with their health and actually get them to a point where they are just going to the doctor less anyway?
Yeah, it's an excellent question, and that really is the causality, because most people realize that they just didn't become obese overnight, or they didn't build up to having a heart attack overnight unless it was some genetic issue like you described. And so the reality is it's a process that got you to be ill that way, and it's a process to unravel that problem and get you on that right track. And usually it boils down to diet and lifestyle and so on. So what we do with everybody that becomes a new member is they do a health assessment for themselves, and allows them to discover a variety of things that they really did not realize, or questions they'd not been asked in the past, to uncover things about themselves that are detrimental to their future health. And now we'll allow them, through our WellFit community, which is kind of our social media community, and that's kind of the doctor-patient relationship writ large, where doctors and patients populate together in there and are able to gather information, find people that you may want to connect with, or you actually can call that concierge and say, look, I figured out I really need to talk to a dietitian, or whatever you think is the beginning of your journey to start building your health back up. Then we're going to help facilitate all of that. And then our tools allow that stuff to be paid for. So that's kind of the better combination. It's a little bit more of a self-directed health program from that standpoint. And that's what's missing. Most people are so scrambled around to get health insurance, but that's just like you were just saying. That's only to pay for a big heart attack. It's not doing one thing to help me prevent having that heart attack. And that's what I really need to focus on, because your health changes every day. You're eating multiple times a day. You're impacting your health. You know, the chance of having a car accident is horrible, but it's pretty remote by comparison. You're deliberately hurting yourself every day multiple times if you're not paying attention. And so we really start to work from that standpoint. And again, most people want to not see the price of their health insurance go up. Well, part of that responsibility is that you do things that don't drive the cost of the thing up. We're going to help find the cheaper place to go to get the mechanical services like an MRI or a blood test. You know, that's just a competitional thing. But you have a very proactive part you need to engage in. And then other part of it is because it's personal that way. You know, every doctor will tell you if they give the same pill to 10 different people, they're going to get 10 completely different reactions to that pill. So your whole pretense has to be built around customization for yourself as you build your way back into perfect health.
All right, now I know there's a couple things that are going to be weighing on the minds of people that like a lot of what they're hearing, think it sounds like a great idea, but you know, there's a couple little things you got to think about. And one of them, of course, that people are going to be wondering is, how does this jive with the individual mandate that goes along with the Obamacare law? That's the reason a lot of people are forced to buy insurance, and they're looking at alternatives in the first place. So how does this does this actually get around that mandate?
Well, it doesn't really get around it as much as it actually satisfies it. The kind of sharing we've utilized in the past was treated as an exemption, and so that was a little bit of a gray area. But now we're a completely ERISA compliant, which satisfies both the individual and the employer mandate. And that's why we're also incorporating an HSA, which you couldn't do in the prior configuration. So it's right on the money that way. It's good for businesses, in other words, because it's an even Steven competitive product to other stuff that's out there. But again, it's going to give you more flexibility. Any doctor, any hospital, you're the one in control. We deliver the money to you. That's a little difference in certain respects. Let's say you're in the program where you're going to pay the $1,000 of this heart attack that you had, we were describing, and the bill in the end was $100,000. Well, you're going to pay $1,000, and Mark, I'm going to send you $99,000, and you're going to pay that $100,000 bill, so that hospital, that doctor, that clinic, that surgical center knows that Mark is in control. Not some insurance company, not some faceless bureaucrats. The person they're looking at is in control. And that's what we're doing, is bringing it back to the bottom, looking upwards.
And the great thing about that is, I mean, if you have a philosophical concept of medical care and how that should be better delivered, you're actually kind of helping with that by taking control of your health care, by you being the payer, even though you guys are going to be paying the bulk of you're be paying all of everyone's medical bills after they pay that initial amount, and we'll let you break down those price points in a second. But you're the one paying the bill, and that is a huge change in so many ways, because you're the one. They're not going through an insurance company to get permission for things. They're not going through anybody but you. And that really is a big change in not just a price point many times, because many times if you're dealing one-on-one with a hospital, you can get lower prices anyway. So you really are helping the overall system, if you will, and the overall move towards a more free market healthcare.
Well, I'll tell you one really huge advantage a lot of people don't appreciate, and why we're doing this similarly in the whole world of the doctors, is that by you doing this as a consumer, you're helping preserve that doctor staying in business by themselves, because they're forced to become a part of some hospital operation or some kind of a big monolithic thing where they go from being an entrepreneur and an individual business owner to an employee somewhere who they boss around all day long. Hey, you only get 10 minutes to talk to that person. Don't spend 15 minutes. And, that type of stuff starts to happen. So you're hurting your own self by supporting that system, because eventually the kind of doctors you want to go to are not going to be responsive to you anymore, because you're not not the one paying their bill. So it's a self-serving benefit for both the doctors and these consumers to get back together again, and it's treat everybody else as to service them and to support them, not to dictate to them, but have their hand in their wallet at the exact same time. So it goes back to good, logical, common sense business relationships, like all of the other things you do are, and get away from this game that's being played where I don't know what anything costs. They say it's this price, then I get another letter that tells me it's only this much, but I got to pay that. I mean, how much layers of confusion does that create? So, yes, we need to get back to sanity, Mark.
You're darn skippy. And I think one last thing that's going to be on everyone's mind is the obvious one. What does this cost? So can you just toss it out? Because, the funny thing about regular insurance or the standard insurance that we're all used to, everyone's price is different. You talk to people about what their insurance costs, it's all over the map. It's all based on, depending on their age and their income level and what if they're subsidized or not. It's very, very simple and standard with you guys. So why don't you just do a quick breakdown of what these prices are and what people can expect to pay in relation to the benefits that they'll get?
Sure. And truthfully, you left one thing off your little list there. It's also dependent on your zip code. So we could both be the same age, but I live in a different, and I live in county than you. My price is different than yours. So what's unique about it is, unlike saying, well, hey, give me your details, I'll run you a quote, we actually have a published price list. The price is the same whether you're 30 years old and all the way up past 65, but most often people go on to Medicare at that stage, so we tend to lose them. We do have special pricing under 30, and I won't run through those right now because that's only a smaller part of what we actually do. But we actually have two flavors, Mark. You can either pay $500 or $1,000 if something happens, and there's some caps on all that stuff, and I won't go into all those details. All of that's up on our website. But let's just talk about the raw numbers. What people really want to worry about is what I got to pay every month. So if you're going to pay the first $1,000 of that heart attack as opposed to the first 500, so let's pick the two. We'll start with the lower one first. If you're going to pay the first 1,000 as a single person, it's going to cost you $249 a month. If you're going to pay only $500, then it's $299. So approximately it's $50 more if you're going to have us take more of the burden. And most people opt to pay the first 1,000 because the likelihood of something happening is a lot lower, and that monthly amount is very stable. I'd rather keep the money in my pocket as a consumer. So if you're a couple, then it's $485 at 1,000 and $599 at the 500 level. And if you're a single parent, like I talked about before, where we're going to take one person, or if they genuinely are a single parent with multiple children, one or more, it's $427 a month for the 1,000 and $520 at 500. And then lastly, the final version is for a full-blown family where it's a spouse, husband, wife, as well as a number of kids. It doesn't really matter how many. And that's $638 a month for the 1,000 or $786 for the family at 500. So those are the raw numbers, and there's a few other little particulars, but that's the main part.
Yeah, and again, like we said, this isn't going to apply to everybody. There might be some people that hear those numbers and they somehow have a better deal, but I don't think that's going to be the case for most people, to be perfectly honest, unless you're heavily subsidized by your company or that kind of thing. But if you're someone that buys insurance on the free market and has a somewhat middle of the road income, like there's just no way you're beating these prices. I can speak from experience shopping around that kind of thing. So I think for a lot of people, it's going to be at least something to take a serious look at, because every year that goes by, the cost of insurance and healthcare just goes up and up and up and up. And like you said, we have to return sanity to this thing, and that is one thing you guys are really helping to do. So I'm so proud to still be a sponsor with you guys. It's been a great relationship we've had over the last few years here, and it's great to have a sponsorship of a program that I truly can get behind, not just financially, not just because it's a good deal, but morally, philosophically, the whole package. So proud to have you guys as a sponsor, and hope some more of our listeners will look into you guys. Jeff, it's been a pleasure. Is there anything else you want to mention or anything you want to direct them to? Obviously, as I always mention in the ad on every episode we're running right now, everyone can find more info by heading over to lionsofliberty.com/health. But if there's anything else you want to toss in, Jeff, feel free.
No, I would just want to encourage your listeners to follow up on a lot of the things that you like to talk about on your show. I mean, all these things that we discuss and you discuss are about personal responsibility and being in control, not looking to some corporate entity or some government entity, which is just a bunch of people in a room, frankly, anyway. You can make much better decisions for yourself, and all the tools are right there. They're only leaders as long as you're standing there as a follower of theirs, but we all have the permission to turn our back and do what's best for ourselves. And that's what we're always encouraging. Just people sometimes are fearful to take that first little step. They just feel like they need to stay in that little box, as it were. But once they get outside of it, they're pretty excited to see all the opportunities that there are, the freedom that they get, and really their health is going to get to be a lot better, which is certainly going to be a huge benefit for them, I assure you. But I appreciate being on your show, Mark.
Absolutely, Jeff. It's been a pleasure. Again, learn more about Health Excellence Plus by heading over to lionsofliberty.com/health.